Welcome to Community Roundtable. I'm Nick Burns from the Salt Lake Community College Division of Communication and Performing Arts, and I'm your host as we explore topics of special interest and concern to the residents of the cities and also the unincorporated areas of Salt Lake County. Topics that we feel are equally important to the general public throughout all the state of Utah. Today, brain injuries. They're in the news a lot these days, from pro football all the way down to high school sports and Little League, not to even mention the dreaded 3 a.m. phone call from the emergency room. So what do we need to know about brain injuries? What can be done, both for prevention and when it comes to healing? Today on Community Roundtable, we welcome the Executive Director of the Brain Injury Alliance of Utah. We'll talk about brain injuries, the symptoms, the causes, the treatments. We'll talk about preventing brain injuries, and we'll meet a medical doctor who herself has experienced a brain injury. So today on Community Roundtable, joining us from the Brain Injury Alliance of Utah, Executive Director George Gehling. George, hi.
Hi.
Thanks for doing this.
Thank you for inviting us.
Oh, my pleasure. And also Dr. Allison Delgado, hi.
Hi.
And as we get into, you yourself are a pediatrician.
Yes, I am.
But when we get into this, I want you to share your story as well, because you not only work with patients, but you've been one.
Right.
So,
yes.
Okay, great, thank you. So Brain Injury Alliance of Utah, let's just start with, I mean, the name seems obvious.
Yes, it does.
But tell me about what you do and how you help people, either those who have an injury or those trying to help.
Yeah, well, we are, as you know, Nick, a nonprofit organization. Our responsibilities extend to the entire state of Utah, and our mission is to provide supports to people who have had brain injury and their families, and to also work in the community to promote education, awareness, and prevention for brain injury. Some of the things we do, we'll work individually with individuals who have suffered a brain injury to help them focus in on what their deficits are, help establish goals that they would like to accomplish as they move forward and improve their condition, and help them access resources in the community that can be helpful in accomplishing those goals.
Okay.
We also support quite a few support groups around the state. They typically meet monthly, and people who have had a brain injury, family caregivers, professionals all have a chance to attend those support group meetings and get support through networking.
Okay.
We focus on providing brain education for elementary, middle school kids with a program called Head Smart, and we offer $5 bike helmets for sale to anybody in the community.
Great.
As a way to foster prevention. You
use that word deficit.
Yes.
And I thought that's very interesting. You know, when somebody breaks their leg or their arm is injured, it's pretty clear that, you know, they can't throw a ball or whatever until they're healed. But with a brain injury, a deficit, I mean, it's much more nebulous.
It's much less obvious to people in the community, but there are quite a number of deficits, challenges that people with brain injury might experience. They can include memory loss, difficulties with short-term memory, challenges in terms of decision making.
Interesting. Emotional issues?
Emotional issues, anxiety, depression. Many different kinds of symptoms all can present themselves, either individually or all together. It just depends on the nature of the injury.
Right. And it seems like, and I don't think this is much of a myth, but it also seems like there are personality changes for some people.
Oh, definitely.
And you talk about support groups for family and friends. I mean, suddenly your dad comes home or your wife comes home and it's not the same person anymore.
Yeah. I can't tell you how many people I've talked to, caregivers, family caregivers, who say, you know, my husband's a great guy. I love him to death, but he's not the same person he was before the injury. And that's simply a result of the injury.
And some people, again, over years, you might go back and be who you were before, or you might not.
That's true.
Yeah. Yeah. So, Dr. Delgado, I want to bring you in here. Some people, you know, it could be, you know, it could be a car wreck, it could be a bike wreck or whatever, but you yourself, who's someone, so not only are you a doctor treating kids, but you're someone who found yourself, what, in a coma yourself?
Yes, I did. I was in my second year of pediatric residency. I was having my first day off of work in a couple weeks. I went out for a bicycle ride and I was struck by a car while I was riding my bike. I was wearing a helmet, but I still had a significant bleed around my brain. I honestly was not expected to make it through that first night. I was in a coma for about 5 days and then started coming to, and they realized that the injury had caused an aneurysm in my brain as well.
So you're bleeding in your brain, and was that something that could be corrected with surgery, or
the aneurysm is what can be, the bleeding just had to resolve on its own. The aneurysm, they coiled it. They did something called coiling. Basically, they put a wire up there and to fill up the aneurysm. And then I went to, after about 3 weeks in the hospital, I went to rehab for a couple weeks. And then unfortunately, 3 days after I left rehab, the aneurysm burst again. So I found myself back in the hospital for another 3 weeks. And then I had to have actual surgery to go in and clip that aneurysm. So for me, it was a very, very traumatic experience for all of my family as well as myself. And my biggest deficits from that injury were initially, the aneurysm was on the left side of my brain near the speech center of my brain. So initially I couldn't use my right arm, which got better over time. But then I had a pretty significant speech deficit as well. I could not think of the words I was trying to say a lot of times. The speech therapist would show me pictures of different animals and I couldn't think of the name of the words.
You had to relearn all that?
Yeah, my husband actually brought in, like, when I was in rehab, he brought in toddler cards pretty much.
Oh, fun.
To show me pictures of things. And I'm thinking to myself, I'm a doctor. I'm looking at toddler cards right now. But that is what I had to do to get better.
Sounds pretty depressing.
Yeah, and that is what I had to do to better. But I was very motivated to try to get back to work eventually. So.
Did your husband notice your personality changing? Were you a different person?
He didn't feel like my personality changed at all. But he definitely knew my deficits and my speech, and even now, most people can't tell, but I still have trouble thinking what I'm trying to say right now. And he notices when I'm saying something different that I would have said before. I try to find my way around it to say something else, but he still knows that. But I really didn't have a personality change, fortunately.
Okay.
So.
I mean, he's a doctor as well, so he gets this to some degree.
Yeah.
Okay. Yeah. We need to take a quick break, but real fast before we go, how many people does the Brain Injury Alliance of Utah serve in a year?
We serve between 2,000 and 4,000.
Wow.
Between, our one-on-one work, our support group work. We have an annual conference in October for people with injury, family members, professionals in the field. And about those numbers, yes.
Okay. When we come back, I want to ask about that conference that'll be happening here in the fall.
Great.
And talk more about the Brain Injury Alliance of Utah. We'll be right back, talk more with the folks from the Brain Injury Alliance of Utah. Keep it tuned, SLCCTV. We are back on Community Roundtable. I'm Nick Burns. We're talking with George Gehling from the Brain Injury Alliance of Utah and also Dr. Allison Delgado. We're talking about brain injury treatment, brain injury prevention, and brain injury support for family members. So when we left off, we were talking about all the different things that you do, which is a lot with the Alliance. And Dr. Delgado, you yourself have been through this. You're a part of the Brain Injury Alliance now, and I know you're going to be a keynote speaker at the conference, and we can give folks details about that. But I want to ask about the treatment side. I mean, the person who is in the bike accident or falls off a building or has a punch of well pipe hit him on the head might not really know what's what compared to all the people around them. So it sounds like a lot of your work is support group for the friends and family.
Right. I mean, it's going to vary based on what kind of deficits you have. A lot of people, especially if they've been in the hospital for a long time, will require a lot of physical therapy. They might require occupational therapy to help with their fine motor skills. I required a lot of speech therapy for several months before I was able to finally return to work. And even after return to work, I was still kind of working on my speech as well. And a lot of times they need counseling because they might have post-traumatic stress from the injury if they remember what happened. And also the caretakers might also require counseling because you can get PTSD just being a caretaker.
Do you remember?
And all that.
Do you remember what happened to you? Do you remember your accident?
I do not remember my accident.
It's probably
whatsoever.
good.
Yeah, it is. It is good. It is good. And I've told people before, I feel like I'm a little more comfortable talking about my story than my husband is because my husband remembers everything. You know, it's a little more emotional for him to talk about my accident because he remembers from day one to day to the final day.
Everything is probably burned into his brain
Yes.
differently than yours,
Yes,
right?
yes.
Okay. So what about things like cancers, tumors, strokes? Is that something you all work with, or are you specifically on sort of the accident side?
No, actually the majority of our work is around traumatic brain injury,
Okay.
which is the accident injury-oriented kind of work. But we also provide the same kind of support services for a whole other category called acquired brain injuries. And that includes people who have tumors or strokes or brain damage as a result of an infectious disease. Things of that nature fall within our scope of support.
And how do folks find out about you or come to you? Do their own caregivers, their doctors say, gee, call these folks?
A lot of it is through the medical community.
Okay.
Okay, the hospitals, the emergency rooms, the therapy supports following hospitalization, the school systems, you know, especially the special ed systems. We have a website, okay, where people can find us, of course.
And we'll give that out too as well.
And word of mouth beyond that. You know, people who have had a brain injury represent a fair number of folks in the community. There are at least 50,000 people who live in Utah who are still suffering long-term effects of a brain injury.
Wow. Okay.
And 23,000 individuals need medical care every year.
Over 20,000 folks.
Over 20,000.
Any kinds of statistics on who all can be 100% better and who all maybe gets 80% better and that is 100% better? Or can we even track that because everybody's so different?
It's hard to judge, but you know, if you looked at the whole range of brain injuries during the course of any one year, somewhere between 75 and 80% of the people who suffer a brain injury are in what you would call the mild category. A bump on the head, recovery is almost certain to happen, almost full recovery in a relatively short period of time.
Okay.
But that other 15, 20, 25%, some of those folks may take years to recover. Some may not fully recover in their lifetime.
Okay.
And as a pediatrician, I just need to say as well, you know, a lot of times when people think of traumatic brain injuries, they think of injuries like mine where some big accident happened, but concussions are a traumatic brain injury.
Good point.
And they need to be taken very, very seriously.
Well, that brings us right to football.
Yeah.
I mean, even pee-wee football and little kids.
Mm-hmm.
So how does that affect your own practice when you have a high school kid or a junior high kid who's been, you know, thumped on the football field?
Yeah, well, it can be frustrating. I mean, it can be frustrating for everybody because, you know, they want to get back into school, they want to get back to football, but it's really just a lot of education. Just trying to say, you know, you had an injury to your brain. Your brain needs to rest. You need to stay home from school right now for a few days. You need to stay off the field for a few days. And we have my colleagues, we have a big system as far as how we get them back safely, because you want to make sure they're totally symptom free before they return to play, because you don't want them getting hit again while they're still recovering.
Well, I mean, that goes
one.
back to what we were talking about earlier, that if your ankle was sprained and you were taped up or iced up, it would make sense to, yeah, I can't play today.
Yeah.
But who can see? The coach doesn't see what's going on in the brain.
And some kids recover very quickly. Some might take a few weeks to recover from concussion. So that varies as well.
How do you measure that?
Basically by symptoms. You know, we always do an exam. the neurologic exam is usually pretty normal. You see a couple abnormalities on the exam with the concussion, but usually it's based on their symptoms. So how bad is your headache? Are you sleeping well? Are you still having any nausea, any dizziness, any sensitivity to lights? There's a whole scale of symptoms that we look at.
And when it comes to like high school kids or younger whose brains are injured, you're asking for self-reporting, which might not be accurate.
Exactly. And I always try to tell them, please be honest. I try to tell them to keep the long-term goal in mind. You know, the long-term goal is for you to be able to function appropriately, to go back to school and do just as well as you did before and be able to play safely. That's the long-term goal. You don't need to be at this game this weekend. The long-term goal.
If you want to play next year, don't play tomorrow.
Exactly.
And does that message resonate?
I think it does for some. I think it takes some time for them to really get that, but yeah, I'm always hoping that the parents are kind of watching over things, making sure they're doing things correctly. Yeah.
Do you think with all the pro football discussion about concussion and you know the one player who killed himself, you know, and shot himself in the chest, so his brain could be looked at?
Right.
Do you think schools and kids are getting smarter and parents about this, about risk?
I mean, I think some people are thinking a little bit more about it, but we definitely get a lot of frustration, you know, back from some parents and coaches as well when we're keeping them out of play.
The coaches want them back on the field, right?
Exactly.
Yeah.
Very good.
Yeah.
So when we come back from break, I want to get into this notion of prevention. So, I mean, you yourself had a bike helmet on. That might have saved your life. But I think there are other things that people can do as well. So when we come back from break, I want to talk about that in terms of your work at the Brain Injury Alliance of Utah.
Great.
So keep it tuned to SLCCTV. We'll be back and talk more about brain injuries and how to prevent them. Keep it tuned. We'll be right back. Hello and welcome. We're back on Community Roundtable talking with George Gehling, Executive Director, Brain Injury Alliance of Utah, and also Dr. Allison Delgado, who's a pediatrician here locally. So as a place to get into this, to talk about preventing brain injuries, we talked about football. I mean, soccer would be the same kind of thing, or rugby if your kid's into that. But what about differences between little kid brains and adult brains in terms of protection and prevention?
I mean, with any activity that's appropriate, I always urge my patients to wear their bicycle helmet when they're cycling. Also wear a helmet when they're skiing, snowboarding. And I tell them, at least the ones who are old enough to understand, I tell them about my accident. I said, you know, I'm not worried about your skill level. I'm worried about other people not paying attention, cars that might not be paying attention to you as well. And I always tell the parents that you should be wearing your helmet too, because it always makes me crazy when I see the family out and the kids wearing the helmets and the mom and dad aren't, because what message is that sending to the kids? But and as far as the really younger kids, we always just try to discuss baby proofing, you know, making sure you've got gates on the stairs so you're not going to tumble down the stairs, even locks for the windows. You hear about kids falling out of windows from time to time, and just trying to keep a close eye on your kids. They move around pretty quickly.
And seat belts?
Seat belts.
Car seats?
And make sure the car seats are in appropriately. You know, there are a lot of new recommendations out there now saying that children should be facing the back in the car until they're 2. And they should be in a booster seat until they're both 8 years old and 4 foot 9 inches. And that's just to make sure they have the best protection. And they should also be in the back seat, never in the front seat until they're at least 12 years old. Okay. So.
And you're involved in the Brain Injury Alliance of Utah is involved in these kinds of educational outreach activities.
Most definitely.
Okay.
You know, the single biggest cause of brain injury is through falls. And a lot of those occur in the home. So some of the prevention ideas that Dr. Delgado just mentioned are absolutely appropriate.
Okay.
Falls affect mostly very young kids, 0 to 4, and older folks, 55 and older. One thing that we encourage among the older population in particular is the notion of getting a lot of exercise, working on balance, things like that to help strengthen your own self physically to enable you to prevent losing your balance, falling down, actually hurting yourself, getting a brain injury.
Okay, so I mean that's a whole different kind of prevention. I mean it's one thing to remember to wear your seatbelt, but it's another thing to think about if my legs are strong and I have good balance and I'm not overweight, I'm less likely to take a tumble.
Absolutely, that's
I mean,
right.
so often old folks get told, well, just get rid of the throw rugs.
That's right.
But there's more than that.
Yeah.
Definitely.
Yeah.
Definitely.
So for little kid brains, heal more quickly, as with other injuries?
It kind of just depends on the injury. It kind of depends on the injury.
Yeah. And one of the, I'm sorry.
No, go ahead. Go ahead.
One of the things that happens is, you know, a lot of people just kind of assume that when we pop out of the womb, our brain is our brain, and that's what we're going to have for our whole life. But that's not the case. It develops over time. It goes through stages of development up till your early 20s, actually. Right. And what happens is, you know, if somebody has a brain injury when they're younger, some of those future developments in your brain can be retarded. So, you know, it's not just a matter of, like, to your point of breaking your leg and getting better, okay? You can have future consequences as well.
So would you consider things like addictions, you know, young kids drinking alcohol, is that a brain injury? I mean, it certainly could be, but is that outside or within the scope of the kind of work you do?
No, it's within the scope. It would be probably more like an acquired brain injury issue, you know. But, you know, we consider that within our scope because a lot of the challenges that people who have injured their brain as a result of those kind of behaviors, a lot of the courses of action to help them improve are similar to
self-destructive, right?
To traumatic brain injury.
Interesting.
Yes.
So what about issues, and this comes up sadly far too often, child abuse? I mean, we have shaken babies. I mean, those are brain injuries.
Yes.
And again, these are criminal offenses and people go to jail or spend the rest of their lives in jail. But how does your work dovetail with helping those infants?
How it works is largely after the fact, unfortunately. You know, a person who's a child who's a victim of shaken baby syndrome is likely to have a severe brain injury that will need care and attention in the long term. And that child will have caregivers who need support in terms of carrying out their role, which is often, you know, one of the forgotten pieces of the puzzle. I think Allison mentioned it earlier, you know, is the role of caregiver. Most often in a situation where somebody has a brain injury, the role of caregiver falls to a family member. And that's, you know,
who might or might not be trained in caregiving.
Probably is not.
Right.
Yeah.
And you mentioned your husband specifically, who himself a doctor, but he's the one who ended up caring for you, and he probably has advantages with his background that many family members don't.
Yeah, yeah, and it's, I mean, I think recovery is all about, you know, having a positive environment. You know, everyone around you has to have a positive attitude and hope that you're going to continue to improve. You know, I've always told you, I was always before my injury, I was always a very motivated person. I was very motivated to recover and get back to normal, but it was also based on, you know, I had a huge support system behind me. You know, my husband, my parents, everybody was there helping me out along the way, and I've had great success in my recovery, but unfortunately not everybody has the same support system.
And George, you mentioned the massive work that you all do in terms of support groups throughout the whole state.
Yes. Yes.
So in the couple minutes that's left, you know, Dr. Delgado, you're a volunteer with the Brain Injury Alliance of Utah, thousands and thousands of people getting help. How many folks are like you who are volunteers who themselves have been through something like this?
You know, I think probably a lot. I'm sure a lot of people with the Brain Injury Alliance have had similar circumstances, either had survived themselves or had worked with somebody who had, because I think after you've experienced something like that, you want to help other people who are going through the same thing. You know, after my injury, like I knew what it was like to be a patient. You know,
unusual for a doctor.
I know. I knew what it was like to be a patient anymore, and I know that feeling of having fear and pain and not knowing what the next day is going to bring. And you know, I like to give other people hope, show them my story and give them other people hope that they can continue to improve as well. So.
Okay, very good. So George, only a couple minutes left. I'm curious, where's the Brain Injury Alliance of Utah? Where do you get your funding? And tell me about this conference you have upcoming.
Okay. We are in Murray. Our address is 5280 South Commerce Drive, which is just off the I-15 exit at 5300 South.
And so where do you get
Funding.
your money? Yeah. You're out begging, I presume?
I was sorry. On the street corners, yes.
Sad but true.
We have we participate in a contract with the State of Utah Department of Health to provide some of our one-on-one services for TBI victims, which provides about 40% of our total funding. The remainder comes from businesses and individuals who make donations and sponsorships for us.
And real quickly, 30 seconds, this
30
conference
seconds.
you have upcoming, and Dr. Delgado is going to be a speaker?
Dr. Delgado is going to be our featured keynote speaker. It is Friday, October 23rd of this year at the Sheraton Hotel in downtown Salt Lake City on 5th South.
Great. Well, we're going to have to leave it there.
Okay.
And for more information, BIAU.org, Brain Injury Alliance of Utah.
Correct.
So George, thank you very much.
Thank you.
Allison, thank you very much.
Thank you for having us.
Oh, my pleasure. Thank you for joining us on Community Roundtable. If you have a comment, maybe you have a question, maybe you have an idea for a future show, please get in touch with us. Our email, roundtable@slcctv.com. Don't forget, of course, you can watch all our episodes archived at slcctv.com. I'm Nick Burns. Keep it tuned. SLCC TV.